Welcome to Holistic Health Heroes, here to help you become your own health advocate and introduce you to some heroes in the holistic health arena. Let's get started. All right, today on the Holistic Health Heroes podcast, I'm joined by Dr. Mark Stengler, who is a naturopathic medical doctor and has been in private practice for over 27 years. He is the author, co-author of more than 20 books, including the best-selling Prescription for Natural Cures, Outside the Box Cancer Therapies, and the latest book of his is from 2024 called The Holistic Guide to Gut Health. He's also the medical director for Emerald Labs, which is a brand that we carry at our store in Naples, Florida, called Nature's Garden. So welcome, Dr. Stengler.
Hey, great to be with you.
I'm so happy to have this conversation today, because I think that there's so much more to be known about gut health. I mean, we hear this term a lot, right? We hear gut health, leaky gut, and I think since we've heard it so much now in the recent years, that we sort of take for granted what really goes into having a healthy gut. So I'm excited to get that part going with you. But first, I wanted to just check in with you a little bit about Emerald Labs and maybe how and why you first got involved with Emerald Labs as a brand.
Sure, yeah. Well, many years ago, I connected with the owner, Rick Simpson. We got along very well, and we had a very similar philosophy. We wanted very clean products. Then what I tried to bring to the table was using formulas of ingredients that had human studies on them, and then duplicating those studies, the dosages, the concentrations in the products. Because as you know, there's a lot of products out there, and some products are therapeutic and clean, and then many aren't. So my whole strategy was let's give like integrative doctors formulas that are clean and available to the public. And so we really agreed on that premise.
That's amazing. I love that about Emerald Labs. I mean, the minute I was introduced to it, I was like, wow, this is really high quality. Yeah.
Yeah. Yeah. So basically, that was the whole key for me. I wanted products available to the public that I would use with patients. And that's what we do actually. I formulate the products. I use them with patients, make sure they work, make sure we're duplicating what the research shows. And then people can get them in stores like yours, which is great and at a good price. And so, a lot of the doctors line products, they are good, but they're also very expensive.
Mhm.
So you can get the same product at a much better price in stores like yours.
Yes, yeah. Well, we love to shine a light on it, and I'm glad we're able to do this today a little bit. And just to hone in a little bit on the quality, I didn't have a chance to look, but is there any information about Emerald Labs? Like, do they have farms I love to hear about the actual growing of the herbs, if that is a part of the story here.
Yeah, no, it's a good question. I mean, not many companies can do that. The ones that can, that's great. So no, we have to go through and source, all our different materials. But like I said, especially like with the herbal extracts, we're really looking for the ones that have the published studies behind them. And so because of that, basically got to go to different parts of the world and bring those in.
Right.
So there's like two things really with herbs, right? I mean, there is if you can grow them and they're certified organic and all that, that's great. But then you have a whole other issue because even if you do that, you may be using dosages and concentrations the studies didn't use. So, there's kind of a trade-off. There's a trade-off. I mean, for me, being a clinician, I still go with, whenever possible, duplicating what the positive studies showed for how they help people and then safety and then dosage and concentration. But that's not to say other formulas don't work. They do. When you have brands, as you know, which don't necessarily duplicate what studies have done. I mean, obviously they can work too, but that's the approach I take.
Well, that's really important that you mentioned about the dosage. That's something I've learned in my own health journey recently is that the method could really be the magic. You could know a little bit here, know a little bit there, be kind of band-aiding certain things, but once you get a really honed in message or method rather, that's when you can really start seeing some real tangible results with healing.
Well, yeah, I mean, that is true. And, I see patients all the time. They come in, they're taking products off the internet and from different providers and stuff like that. And, they may come in and they're on what should be the right thing. And then we look at it closer, whether it's, vitamins, minerals, whether it's herbal extracts, whatever it is. And then you look at it and the patient states, well, I did this for a period of time, but there's no benefit. And then you look at what they were taking and, they're taking 1/5 to 1/10 of what the positive studies use. So we can't say it doesn't work. It may not work, but we really don't know at this point.
We've definitely had that experience too in our store where we will give
Mhm.
direction to say, make sure you're taking this, throughout the day or multiple, to make sure that you get the right dose. And then they'll come back and say, it didn't work. And we say, well, what were you taking? One a day. Oh, no, no. We have to go through that
Right.
educational process with people too. So I can relate to that.
And we see kind of the opposite thing. You'll see some studies done in the conventional medical world on certain products. And then you start looking and they say, oh, it doesn't work. And then you look at the details of the study and they're doing the same thing. They're using a fraction of the dose of what the studies used, or they're not using, maybe like the same bioidentical nutrient, like natural vitamin E, they're using synthetic, and then they conclude it doesn't work. I mean, it's really crazy when you start looking at the way some things are done.
Oh yeah, absolutely, absolutely. Okay, so I definitely want to get and spend a lot of time on leaky gut. I have so many questions for you. And to sort of kick us off, one thing I was thinking about as we were, coming up on this date, our scheduled talk today, is just how I think that most people out there, if I'm speaking in generalities here, they have a hard time understanding just how crucial your gut is to your overall health and how it's just connected with so many things. So maybe we start at the very beginning and talk about, what is the gut to begin with? Because I think a lot of people just put their hand on their lower abdomen and think about their gut. And then how is the gut in shorthand is probably a long answer, but so what is the gut really to begin with? And then how does it connect it to the overall health, if that's not too broad?
Yeah, no, it's fine. I mean, some people use the gut, the digestive system, the gastrointestinal system kind of interchangeably. I mean, for me, kind of the general category is the digestive system or the gastrointestinal. And that basically goes all the way from the mouth, for lack of a better term, to, through the bottom, through the rectum, right? So it's the whole passageway. I usually, for gut, when people use that word, typically we're referring more to like the small intestine area. Now, of course, when it comes to digestion, we chew our food, mix it with saliva. There's some enzymes there, break food down to some degree, especially fats and carbohydrates. Goes into the stomach, where we do have a gastric lipase, an enzyme that breaks fat down, but mainly the action is with hydrochloric acid and pepsin to liquefy food, especially break the proteins down into amino acids. And then, really, when we're talking about leaky gut, and this is kind of the key area, that's the small intestine. And there's three parts to the small intestine, which is pretty interesting because when you spread out the surface area, it's almost the size of two tennis courts.
Huge.
So, yeah, huge. So it tells us something. There's something very important going on there. But basically, the small intestine, let's call it the gut, that is the gatekeeper of the body, of what is getting inside into the bloodstream and what cannot. So if we have a healthy gut, then obviously we want to absorb nutrients and components that we should be absorbing, and then not absorbing things that, are toxins or bacterial metabolites, things like that. So with a healthy gut, it acts like a gatekeeper. We're absorbing the nutrients we need for energy and sustain life and rebuild our tissues and keep out the bad things. So with leaky gut, which is very, very common in America, and that was kind of the basis of my whole book, The Holistic Guide to Gut Health. With leaky gut, you're getting a breakdown of that lining of the small intestine of the gut. And so it's not acting as a proper gatekeeper, which regulating what should be absorbed and what's not. And there's a couple different aspects. Feel free to disrupt me because I can talk for a while on that.
Yeah.
But um, one aspect, of course, is we have to absorb the nutrients. So if you have problems with the lining of your gut, you're going to get malabsorption and you end up with nutrient deficiencies, which obviously causes health problems. But the other part of that is you absorb things you shouldn't be absorbing, certain toxins, for example. I mean, most specifically, you're absorbing molecules larger than what you should. Maybe they haven't been broken down well enough, and then your intestinal lining is more porous. You're absorbing things you shouldn't. And then that is going to have not only a localized effect in the gut, but also an effect systemically. So
Hmm.
we do know it's been shown conclusively where people can, have malabsorption with leaky gut, and then that creates other problems in the body. So whether it be brain fog, a flare up of joint pain, muscle pain, I mean, the list goes on and on. And so, it's just a very common condition that people have. And the body does have a way of healing up your small intestine. It's very interesting. In our small intestine, we have in the lining, deep within the lining, we make stem cells.
Mm.
Stem cells which come up and then heal up the lining of the small intestine. So if you give the right environment, which is what you and I do with people, you go through diet and the right supplements and exercise and stress reduction and all that. If you give the right environment, technically, you can replace your small intestine completely, the lining, within 4 days.
Wow, that's
You give
really
the,
amazing.
yeah, they've done that research, if you give it the perfect environment. Now,
Yeah,
so
that's
we're
the
working with
challenge.
people. Oh, go ahead.
I was saying that's the challenge, especially in the context with which we're living today. I mean, I have to say, like, what you're saying is, I don't know, is it weird to say that's my love language? Because I'm always saying the gut thing, and if you have nutrient deficiencies, you're going to have problems. I met so many people. I mean, see it even in myself. Like I said, I have my own health journey here. It's part of the reason I'm doing this is that foundationally, your gut is just the entryway to health or disease, really. It's like you're feeding it 3 times a day. And then what are you feeding it with? We have a big problem with our food system and, the environment, our water, our air, everything's polluted. People have, exposure to heavy metals and just, there's the glyphosate. I think there's even the Supreme Court, case going on today about
Hmm.
chemicals happening, and whether or not they're going to get away with no liability and all these, things that this world in which we're living. Meanwhile, people are out there eating, seed oils. They don't understand, I think, the level of, I mean, some people do, and that maybe is growing more understanding. But I think when I run into the average person, just in my daily life, that they're filling their grocery cart still with things that are harming their gut and therefore harming their health.
Yeah, and that is the challenge. And that's why most people don't heal up in 4 days with their stem cells because there's so many factors, right? So it's the standard American diet, which all the components of that, which you've talked about, I'm sure, many times. Then there's environmental toxins, as you talked about before. Then there's the effects of stress, which basically when you're under chronic stress, not handling it well, you get less circulation to your small intestine. So you don't get healthy cells because your cells in part are dependent on like the nutrients and oxygen coming, for the cells to regenerate naturally in your small intestine. And there's so many factors. So that's why with people, yeah, you've got to address the diet and give them the right nutrients to heal up. But like you said, there's so many other factors that come into play. And you raise a good point. Like I had a patient actually just yesterday where she had B12 deficiency, it's like next to the extreme. And of course, she had fatigue and some other things that went along with it. Never been diagnosed before, just with a simple blood test. So, first question I would ask her is, do you avoid red meat or are you not getting foods with B12? And it's okay if you're not. We just gotta, find out. Well, she did not avoid red meat and foods high in B12. So obviously there is an absorption issue. So now we got to dig deeper and address that. Yes, we're going to give her B12, but we always want to dig deeper. And if I could just say, the interesting thing a lot of people don't realize is that with leaky gut, it has been established as fact that there's what's called the gut axis, basically to every organ system of the body. So there's messaging that actually goes back and forth from your gut to your brain, to your skin, to your liver, to your heart, to your muscles, to your joints. I mean, basically everywhere. So that's like you said, when there's a problem with the gut, it can affect you everywhere.
Yeah. And then, you have, I think, a lot of folks that do their best there, with the internet and the age of information, right? It's the age of information, not necessarily the age of knowledge, where
Mhm.
you're distracted by so many things. You get an ad for some probiotic, or you see some, person talking about this, that, and the other nutrient or food that's supposed to heal your gut. And it can be very confusing. Your head starts to spin with all this information. But there is a way that there's a lot of things that people can do to help heal their gut. And I know we're going to get there, but I was curious also though about, like, you're treating patients, like you said, you're talking to people every day about this. What do you see is like the number one gut problem people have today? Is there a number one, or is it just too complex?
Well, certainly like leaky gut is very, very common. I mean, statistically, the number one problem would be irritable bowel syndrome.
Mm.
But even that at the root of it is leaky gut, right? So there's a few different types of irritable bowel syndrome, but basically it's where people can have symptoms like gas, bloating, abdominal pain. Some people get constipation, some people get loose stool, some people get a mixture of the two. But really, it doesn't tell you why the person has it. At the root of it, usually there's leaky gut, and then going deeper than that, it's their diets, their stress, it's their digestive organs aren't breaking food down. They don't have the nutrients to heal up their gut. There's toxins, so it kind of still goes back to that. But statistically, it would be leaky gut. Now that being said, I mean it's amazing how many people have acid reflux, and then
Yeah.
that leads to this is one of the big contributors to leaky gut is because people who are on the proton pump inhibitors and the medications which suppress stomach acid, we know that they, first of all, compromises your ability to break food down, obviously, especially proteins. So that's going to put more stress in your small intestine and absorption. Second, we know these people are prone to all sorts of nutritional deficiencies. Now, why is that important? Well, not just for energy and how you function, but again, your gut needs a variety of nutrients to be healthy, for the lining to be healthy, all sorts of different ones. So you're causing a problem there. And then we know these people, they're prone to having microbiome problems. And of course, we have the microbiome from the mouth all the way through the whole gut. So, the flora balance becomes a problem, and that contributes to leaky gut and all other sorts of problems. So it's amazing how many people owe, the millions of prescriptions for that each year.
Oh yeah, definitely. And like you said, well, I think, one thing I was thinking while you were mentioning that there is that's another misconception that I encounter is where people are still taking these antacids, when they really actually might need more acid, like hydrochloric acid or something like this. But that's not the only solution, of course, but that's some some of the problem. One of the sections that I was listening to in your book this week was about some myth busting, and I on the podcast regularly like to bust some myths. So, is there a myth or two that you can help us bust?
Oh, absolutely. Well, I'll give you a couple. Let's just start off with what you're saying about acid reflux. I mean, acid reflux is very rarely caused by excess stomach acid. I mean, this is just known in medicine. This is where people have rare tumors in their stomachs, producing stomach acid. I mean, the problem is from basically these valves. It's called the lower esophageal sphincter. It's a valve that's not closing properly. That's why people are getting acid reflux. But at a deeper level, holistically, why is that valve not closing properly? Number one cause is weight. Being overweight, you're putting pressure, on that valve. Number two would be you're creating excess gas, and that's putting pressure on the valve, and that's keeping it open. So for a lot of people, I mean, you can actually improve that valve function, so you're not getting acid reflux. So that's a myth. I mean, I think the another big myth, which I addressed in the book quite in detail, is I mean, still to this day, I mean, most doctors would say leaky gut is not a real condition.
Hmm.
But yeah, so that would be a myth. Which in my book, actually, what I did was I cited from multiple mainstream medical journals, like the Journal of Endocrinology, Journal of Immunology, cited from Harvard, and all this, where they admitted that leaky gut is a real issue. It's not some theoretical thing just the holistic practitioners and stuff are making up. So I cited from their own primary literature. Interesting, I saw a YouTube video with a medical doctor just like 2 days ago. He's got 14 million followers. And on there, he was saying that leaky gut it was not a real condition and all that, which
Lord.
is, I mean, it's right in their own medical literature, like from their primary journals. So, anyways, that definitely is a big myth. And then myth number three, I would say just be, for all the common conditions, acid reflux, irritable bowel syndrome, colitis, inflammatory bowel disease, indigestion, that really these need to be primarily treated with medications. I say that definitely is a big myth for sure.
Yeah, I think that's, so important to bust those myths because lots of people are just walking around thinking that's the case. So it's
Hmm.
good. And another thing that I made note of here, and we already sort of touched on it, is just how critical the gut is to all the different systems of the body. There's the gut-brain connection that we've heard of, but the gut-skin connection. I think a lot of people are focused on mental health these days. They're talking about mental health, and the circles, at least again, that I can reference and just experiencing with the average person is they're not thinking of it as connected to the nutrition so much or their food or what they're eating or their gut then, And so what do you think people need to really understand about that whole gut mood connection?
Yeah, there's been a lot of research on that gut-brain axis. And so certainly there's a couple things. So yes, how your small intestine health is and the messaging to your brain that can influence your mood, like anxiety and depression. Of course, there's a tremendous amount of research right now in making the microbiome, let's say, more favorable, healthy, and how that directly affects how you produce neurotransmitters in the gut and in the brain, which influences mood. And actually, it's a big thing in medicine right now. Of course, they're trying to isolate things very precisely and make drugs and stuff, but for sure, there's a huge influence on anxiety, depression, mood, cognitive in terms of like memory and concentration for gut health. And like I said, there's multiple reasons. It's the microbiome because that makes well, it's involved in detoxification. It's involved in making neurotransmitters. It's absorbing the nutrients that your brain needs to function properly. So definitely, people who have like chronic anxiety, depression, they should at least, as I would say to them, at least in part be working on their gut. Besides if they're doing, direct things, supplements or medications, for the mood or concentration, they should always be at least in part working on their gut to get the best results.
Absolutely. Absolutely. So since we are shining a light back on that small intestine, I know one of the things I learned recently was okay, so what makes the small intestine go awry? There's a lot of things. I would think normally I think, okay, glyphosate, food system, that's kind of where my brain goes first, having studied nutrition to some degree. But there's also infections. So
Yeah.
what are some of the common infections that are tripping people up in with their small intestine?
Well, I'd say the number one thing, it's not really thought of as an infection anymore. It used to be in that category. I guess people could argue about it, but I would say small intestine bacterial overgrowth is very, very common. So that's basically we get bacteria in your small intestine that shouldn't be there. They come up from the colon into your small intestine, and then that causes obviously microbiome imbalance, and that causes leaky gut, and that's been very well demonstrated. So a very high percent of people have like irritable bowel syndrome, for example. They have SIBO, they have small intestine bacterial overgrowth. So that's kind of going like a level before the leaky gut. Again, what's triggering the leaky gut? Definitely small intestine bacterial overgrowth is occurring. And why does that happen? There's a few different reasons, but again, we talked about the medications, the proton pump inhibitors, the Prilosec, and all those. That predisposes people to small intestine bacterial overgrowth known as SIBO. Sometimes people have food poisoning and it damages the motor neurons. And then, your peristalsis or gut contractions, motility isn't working properly. And so things don't flow through properly, and the bacteria comes from the colon up into the small intestine.
Hmm.
So that's recognized in medicine well. And that's why it's so important to keep the bowels regular, at least in part, especially for people who have a history of that condition.
Yeah, that makes me think of like people who have chronic constipation. Seems to be like a really rampant problem. Um, wow. I mean, so so the thing that you just said just kind of blew my mind about how things can start to go in reverse, like they
Yep.
go in the wrong direction. Um, yeah. I mean, this might be a tough question to answer, but what do you suggest when you run into someone who has chronic constipation, for example?
Well, first of all, just let them know that I don't agree with the medical model. I mean, in the medical model, they basically state if you're having a couple of bowel movements a day, that's normal. I mean, a week, sorry, a couple of bowel movements a week, they
Right.
say that's normal, not to be concerned about it. Um, they'd say, straining and all that is a symptom of constipation too. So say, well, that's not normal because we do know, and we've known this for over a decade, that actually, like in the colon, this isn't just an area where things just pass through. I mean, you can reabsorb water there and sodium and things, but what they have found over a decade ago is that bacterial metabolites actually get reabsorbed from the colon into the bloodstream, which means like if you have constipation and the fecal matter is just sitting there fermenting, creating the bacteria metabolites, you actually absorb those into your bloodstream, and then you're creating systemic toxicity. In the old days, it was called endotoxemia, meaning endo like within. So you're creating toxins from within, endotoxemia. So that is a fact. So they just, yes, does it kill people? No. Does it cause health problems? Yes. So they don't really address that properly. So I just let people know about that, obviously. And then we try and, as you would do, being, trained in nutrition, start with the basics. How's the water intake? How's the fiber intake? Then go on, are there like certain food sensitivities, maybe aggravating constipation, maybe like dairy products for some people, wheat gluten for some people, go through that. Are they exercising regularly? Several good studies showing people exercise regularly, the bowels move better, makes sense. Then stress, how their stress is. There's some other things which have been studied, like even that people who like have routine of going to the bathroom the same time every day to try and get patterns going, that can help constipation. And then for people where those basic things aren't helpful, and about 50% of people, just doing those things works well because look, the average American is a far cry from the 25 to 35 grams of fiber a day they're supposed to get, or at least
Right.
half their body weight in ounces of water. So the vast majority of people aren't anywhere in that ballpark. So for a lot of people, just doing that consistent will make a difference. But obviously, there's people like you and I we talk to where they do those things and they have very healthy diets and lifestyles, and they still have issues. Besides ruling out other things like hypothyroidism and other issues, then that's where we got to go in and use supplements, to help them out, move their bowels more consistently. Use the probiotics, try and get their microbiome working better on their own, which there's studies showing probiotics can help that. I like to always like for people in this situation, I like to actually start at the top. I like to use supplements which stimulate their own digestive function, not as like an artificial way of, just getting their bowels to move. Like bitter herbs, for example, stimulate,
Yeah.
the stomach to work better, the pancreas to release enzymes better, the bile flow from the liver and gallbladder work better, and just tonify all the digestive organs because they all communicate with one another. So there's reflexes. When we eat food, even before we eat food, we're thinking about it, we smell it. Reflexes should be happening already, right? Where it's telling
Mhm.
the stomach, get ready, start working. And when food hits the stomach, there should be reflexes going to the small intestine, get working, start moving, and then from the small intestine to the large intestine. So there's all these reflexes that should be working, but may not be working for people. So if you get the digestive organs working better on their own, then that can help long term, really treating the root of chronic constipation. But there's always, some people it's just problematic. Sometimes they have structural problems in their colon, things just don't move through. Maybe they had surgeries and stuff. So then we can use other supplements. I like trifella, is a nice one. People can use long term, a blend of three Ayurvedic fruits. People can
Mm.
get from health food stores like yours. And then there's all sorts of other supplements that could be used. Yeah.
Yeah. I know a couple of our favorite from Emerald Labs at least is the digestive health and reflux health is, something that we sell a lot of and, recommend to the right people that are having these
Yeah.
kind of challenges. Another back to the infections a little bit. I know SIBO is a big one, but also I did another episode not too long ago on just the how common things like Epstein-Barr virus are. They're so very common, sometimes activated in people, sometimes not. So maybe you don't know you have it, but you might have it. All these kinds of things. Do those things also impact the small intestine if you have infections like that? I guess it's an infection.
Yeah,
But
you're right. Yeah. Yeah, they can. And we've seen a lot more people Epstein-Barr since all the COVID, let's say, fiasco broke out. So, in the literature, a lot of people who had COVID or have it, it reactivates the Epstein-Barr virus, which is the virus when we were younger for most people, when you had mono, if you're tired for a week or two, you had mono. So it always stays in our system. But when you have traumas to the body in different ways, it can be reactivated. But anyways, the published literature shows that a lot of people do get reactivated Epstein-Barr, which not only gives them fatigue and inflammation, but can cause gut problems for sure. And we do test patients for that. And we do see, a number of people it is reactivated. And then you've got to do things to help the immune system as well as the gut, which I guess I should have mentioned at the beginning, 75% approximately of our immune, let's say, power activity comes from the gut, mainly within the small intestine. For example, the gut-associated lymphoid tissue, these patches of lymphoid tissue make antibodies and white blood cells. So if you're a person who has immune problems, like you get sick easily, for example, or the opposite, if you have autoimmune conditions, this is why treating the gut is so important because that immune system, let's just say regulation, And, the biggest chunk of it comes from the small intestine, comes from the gut. So if you got leaky gut or you got infections in there, you're not absorbing food properly, you are causing immune system dysregulation. So to help those conditions long term, you got to, again, work on the gut.
Yes. And another thing I just thought of too is like the prevalence of things like candida or yeast overgrowth. I'm sure that's also something that impacts your, well, I know it impacts their digestion, but maybe you could speak to that a little bit as well, because I think people still don't know what candida really is or if they have it.
I agree 100%. I do a lot of stool testing with patients and blood tests, and we see a tremendous amount of people with candida overgrowth. Well, candida refers to Candida albicans, a type of yeast, which actually is naturally occurring in our gut. When we say the word microbiome, it's more than just bacteria. It's bacteria, viruses, and yeast. That actually is what makes up the microbiome. It's not just bacteria, and they actually do work, and they should be working symbiotically. In other words, having those things in the gut actually do help us. They help our immune system, they help us make nutrients. It's not abnormal. But when people are consuming high sugar diets, excess alcohol, they've been on antibiotics, steroids and things for infections, inflammation, that leads again to the imbalance of the microbiome. And then these things overgrow, like the candida overgrows and becomes opportunistic. And so classic symptoms with candida or yeast fungal overgrowth would be gas, bloating, malabsorption, acid reflux, fatigue, brain fog. You get systemic effects from it too, craving sugar. So yes, we see that a lot, and we do a lot of antifungal treatment. So with these patients, we'll give them like antifungal herbs mainly, sometimes medications, but mainly just herbs, antifungal herbs, like the ones you have at your store, the oregano and all the other ones. Get the levels down, continue to work on balancing the microbiome through their diet and probiotics. And then once you get the levels down, your gut should be able to keep those things in check into the future, like healthy people. So that approach works well. Get the levels down using the herbs, also cutting the sugar out until you get to that point, and then just maintaining good microbiome balance. And these act like guards, if you will, to keep these opportunistic bugs in check.
Yeah, and I was just talking to someone recently about how they're having such uncontrollable sugar cravings. And she's like, why do I have this? Why so many cravings? It's like it's taken over my brain, and it's like, that's the bad bugs, right? That's that imbalance, really.
Yeah, people with the candida overgrowth definitely, they crave the sugars. And so for these people, they can do all sorts of things. Um, but if they don't get rid of the candida, it won't be resolved. There's some other people, yeah, they just have blood sugar swings and that's why they crave it. And, with their diet and certain supplements, you help to balance that out. But you're right, if they got the candida, then you have to address it. I just treated a patient, just talked to him earlier this week, and we were treating him for chronic digestive problems. He had done some testing, and we had treated him, and he had improvement. But it wasn't until we treated his candida that he had significant and total resolution of his symptoms. As he said, we finally hit it. Hit it in terms of we finally hit like a major root issue as to why his chronic digestive problems were going on. So it's pretty amazing how many people do have a problem. But it does make sense because if you think of all the simple sugars people consume
That's
and the
right.
antibiotic use and all that, it makes sense.
It's rampant, but yeah, it's something we got to get control of, or we can't really regain the full health of what we were supposed to have. Another connection there, it's another customer I'm thinking of. I was happened to be in our store, and they were talking about their skin, health, and I think they were looking for something topical, and I started talking to them a little bit about the gut. And but can you speak a little bit to these problems where people are seeking topical solutions, the eczemas of the world and other things, but how they actually stem from gut health?
Oh, for sure. Yes. I mean, we have that known gut-skin axis, and so there's a direct communication pathway. So basically, if you have problems in your gut, it's going to create more inflammation in the skin. So there's that pathway. Number two, we know conditions like candida, for example, definitely flare up, skin problems, eczema, psoriasis for sure, things like that. And then third, if you're having malabsorption, then again, your skin's a renewable organ, if you will. Actually, behind the microbiome, it's the second largest organ in the body. Microbiome is considered an organ now,
Mm.
the
Oh,
largest
wow.
organ in the body. yeah, in medicine. So the skin is the second largest. So basically, look, if you don't have the nutrients for skin health, one key one, of course, would be like omega fatty acids, omega 3s, which most people are low in. So your skin cannot keep inflammation and heal by magic. It has to have those nutrients. Vitamin D you need for healthy skin. You need C, you need other nutrients. So that's the connection there. So I always tell patients, look, if you just have, a skin issue for a few days or whatever, you haven't had before and use something topical, hopefully natural, not a problem. But if you got a chronic skin problem, you need to be working on your gut to eradicate the trigger of why you have that skin issue.
I wonder if have you seen more skin issues since COVID too?
Honestly, we seem to see a flare-up of all chronic things. I
Mm.
mean, and that does correlate to literature because the skin, like when you're looking at the eczema and psoriasis, I mean, anything that creates inflammation in the body tends to flare those things up. And so, people who either have, problems from the vaccines or people who have COVID or post-COVID syndrome, then they just have a chronic inflammatory issue. And so basically, you're finding everything flared up.
Yeah.
Which kind of the common thing is like you see a patient and they haven't had an issue, say, if they're eczema or psoriasis, let's say, for 10, 15 years. And then they had an issue with COVID, whatever it is, and it's flared up and it's been flared up ever since. So that's kind of the stories we hear from people.
So many stories out there that are just mind-blowing if you're paying attention, if you're listening. I know that in the book, again, referencing your book I listened to this week a little bit, you really go into a lot of the herbs that are so supportive, nutrient supportive to your gut. So maybe we could outline, like I remember hearing you talk about slippery elm and boy, lots of other things, but
Yeah.
you're right. Yeah,
Yeah. Maybe marshmallow root and things like that.
marshmallow
Yeah.
root. Yeah, yeah, marshmallow root. I should remember that because I want to make marshmallows soon.
Oh,
But
yeah. Well,
but
I mean, I think I kind of have my favorites. Now, there's many things people can use. Now in terms of things which have studies on them, in the published studies and the things I've seen over 30 years work well. The things that I like the most, I can list them off. We can talk more if you want about them.
yeah,
But certainly glutamine, is very important for normal cell turnover in the small intestine and large intestine. So we can talk more about that. It is the primary fuel source actually for your intestinal cells. I'm a big fan then of aloe vera extracts, very soothing, anti-inflammatory, gut healing. DGL licorice, is excellent. Um, Not only is anti-inflammatory, it stimulates small intestine cell healing, but it also helps to create that natural mucus layer, not only that you have in your stomach, but you should have in your small intestine as well. And then I do like the soothing effects of marshmallow root and slippery elm. Those are like the top ones I use. Sometimes I use others, but those are the ones I use the most consistently with really good results. Again, as we both know, that's you should be using those things with a healthier diet and lifestyle and all that. But in terms of nutrients, yeah, when people do that, I think it accelerates their gut healing, 5 to 10 fold than if they don't do it.
that's awesome. I love talking about herbs because it's like, these are things from the earth that we've been using probably for centuries and just have so many healing properties. Aloe vera, like you say, and that's in every health food store. You want to make
Hmm.
sure you get a good quality one. Okay, always look at those ingredients. Marshmallow root, slippery elm. Just cool stuff. It gets me excited. It's when I nerd out on herbs. Um, so what about, okay, so there's supplements and there's lots of things to do there. But there's also nutrients to heal the gut. In terms of food is what I think. Is that kind of your philosophy too? There are
No,
nutrients in.
you're right. And there's various nutrients been shown to be required for normal intestinal cell turnover, so you have healthy cells. Some of the key ones in the studies, vitamin D has a lot of studies on it for that effect, and it seems like vitamin D affects everything, right?
So many things.
Um, the other one, very well studied, we know you need it for healthy gut. A lot of people don't think about it, but that's vitamin A. So vitamin A rich foods, very important, or vitamin A in supplementation. That's very important for gut healing. So that's one a lot of people aren't aware of. And then you have other ones like vitamin C, for example, is important as well. So those are some of the key ones that people do need for good gut health. And then, like I said, glutamine is an amino acid, but nevertheless, it's something people can get by itself. It's something you get things like in whey protein powder, protein foods. But usually, when people have gut problems, we want it to heal up. We usually recommend people supplement it, and preferably like before or away from meals, so it's not competing with other amino acids. And that acts as a fuel source for your small intestinal cells as they're turning over, so they can turn over in a healthy fashion. And so there's good studies on that for leaky gut as well as even for conditions like irritable bowel syndrome. So it does have a gut healing effect. You don't have to take it forever, but a lot of people do it depending how severe your case is. 2 months to 4 months usually works well. A lot of these things, as you know, we have that in the Emerald leaky gut formula, so you can get a lot of them in one. But your stores like yours, you have all these things individually too.
Yeah, yeah, that's interesting. Yeah. We tend to see a lot of people that are obviously just struggling with different things. They come in and they're seeking some answers, some support and supplement wise, and we try to guide them as best as we can, depending on what they share with us. And some of them are pretty sad stories. There's a lot of people out there that are dealing with chronic issues, long-term issues, and maybe then they've accelerated and they've gotten worse and things like that. But I'm really fascinated with the body's ability to heal. Like we said before, if you give it the right conditions, it can heal. I mean, have you in your practice, I'm sure you have worked with people who have chronic digestive problems. Like, is there a story that you could tell us to give us some hope?
Yeah, I've had several over 31 years. I mean, put it this way, we like people with irritable bowel syndrome. I mean, we do very, very well. People in the nutritional world do very well with irritable bowel syndrome. I mean, in my opinion, heads and tails better than what gastroenterologists can do. I mean, they only have a couple of medications, and the results of those medications and studies aren't that impressive, really. So irritable bowel syndrome, we expect people to do phenomenally well within 1 to 2 months. That's what we typically see with that. I'd say the more dramatic cases would be patients, for example, have inflammatory bowel disease, conditions like Crohn's disease, ulcerative colitis, which can be very serious, where people are bleeding in their gut. They're having multiple stools a day, diarrhea, abdominal pain. Definitely had patients where we've treated them with aggressive natural therapies and they totally cleared up. There's other patients where they're on the medications, the biological medications, and then we treat them naturally and they're able to wean off those. Those are the more dramatic cases because those cases actually, can be very severe and people can be hospitalized. So you're really putting to the test whether these things we're talking about with diet and supplements and holistic healing, how powerful they really can be. So when you see those cases turn around, I mean, that's really a testimony that what can be done.
Yeah. Yeah. So those people with Crohn's and these things like they're really serious. They can, and you've seen them have reversals.
Yes, and in my opinion, I mean, because we have the biological medications now, which can suppress the symptoms, and in very severe cases are needed to keep people out of the hospital or have life-threatening problems. Um, for the people doing that, that's fine, but they should be doing the things we're talking about to give them the potential to not need the medications ongoing, because those medications, of course, can have very serious side effects. You're prone to getting serious infections. You're more prone to have certain cancers and stuff. So especially, when the young people are on these medications get stabilized, unfortunately, the gastroenterologists don't do what we're talking about, which is working at a deeper level as why the gut's having problems. And so, it's making it harder for them to get off the medications. They have a whole life ahead of them. And while their quality of life's better now, they're prone to getting serious infections, maybe cancer. So it's just, it's something where they need to talk to people like yourself and myself to take it to another level.
Yeah, to think more, holistically, to use that word again. Um,
Hmm.
Gosh, I can't help, there's two bigger questions here that I still have for you. One is now that we've talked about this, I can't help but think about the Ozempics of the world, like the GLP-1s out there and the gastro problems that are being reported. Are you seeing an increase with that? Are people coming to you for that or no?
Oh yeah, yeah. I mean, there's so many people on them nowadays. I mean, I think everyone in practice, they're gonna have, several patients on them, right? So I think now that those medications are actually coming out in pill form, starting to come out in pill form, I think you're gonna, it's estimated probably it's very possible that a fourth of the adult population will be on
Wow. Wow.
once the pills come out instead of the injections. So it's
Wow.
going to be a lot of people. But yeah, usually on those medications, as we talk in our clinic, for most people, it's not a matter of whether you're going to have digestive problems. It's going to be a matter of which ones you have and how severe they are. So the
Yeah.
vast majority of people are going to get constipated, some nausea, some indigestion. So for most people, it's not a matter of if you're going to have, it's just a matter of which ones and to what degree. So those people who are on them want to be on them. We definitely get them on supportive treatment. They need extra fiber supplementation for sure. They need to be on probiotics for sure. You may want to consider things like, ginger capsules, liquid, or teas on a regular basis too, because they're going to have motility problems. We use the emerald leaky gut a lot in those patients preventively and for treatment. So yes, all these people on GLP-1s, they should be using these supplements because they're already so predisposed to having problems to offset or minimize those side effects. I know a lot of my colleagues in our clinic, we just, even before people start on them, we're giving them these recommendations. Get on these now because you're
Yeah,
going to
that's
get them. So we just want to minimize it.
wow. Wow. Good to know. I can't say that I'm surprised exactly, but good to know confirmation from you that, what you're seeing and saying there. But
Hmm.
another thing that's again a huge topic, and I want to be, aware of the time here with you. But you have another book about alternative cancer therapies, yeah? And I also too, I've heard in my life just the increase of different cancers here and there from various people. I know younger people, as we see in the headlines, getting cancer. And again, I think to myself, do these folks know the critical nature of nutrition when it comes to now having to deal with cancer too? Um,
Hmm.
in these last few minutes, what can you tell us a little bit about maybe your other book regarding this topic? I guess the connection between the gut and having cancer or preventing cancer.
Yeah, so yeah, that book's outside the box cancer therapies. And so, yeah, because again, 70 to 75% of our immune system activity is coming from the gut. We want our immune cells to be on high surveillance and identifying those cancer cells and taking care of them as our body does do every day. So we got to make sure that's maximized. Two, cancer, like most chronic diseases, is often a state of nutrition. So if you know, have deficiencies, certain nutritional deficiencies, there's no way your immune system can work properly. Number three, most of the inflammation comes from the gut. And we know cancer, one of the hallmarks of cancer is that it's a disease of chronic inflammation. I mean, that's just mainstream oncology. So you're reducing your inflammation, you're reducing risk of cancer and other chronic diseases. For people with cancer, I mean, we do talk about in the book about some research where really a lot of people succumb to cancer, interestingly, from malnutrition.
Wow.
Malnutrition. Yeah, malnutrition.
In the United
Because
States,
basically,
is that in the United States or globally, like malnutrition?
well, people with cancer, yeah, so people have cancer, ultimately, a lot of them succumb because of malnutrition. What do I mean by that? Well, we know it's very well known in oncology that people's risk of death mortality is highly related to their muscle mass and secondarily their body weight. So as you know, in oncology, people don't get much nutritional guidance. And so basically, they have the cancer, they're on the chemotherapy, whatever treatments they're getting, and then they're getting tissue wasting. And then ultimately the body breaks down and the immune system breaks down. So they're not getting the nutritional support they need. And still to this day, I mean, patients come in, with cancer because we give them supportive treatment and they ask their oncologist what to eat, and they literally, and I'm not exaggerating, told diet has nothing to do with it. Eat whatever you want, you know, and all the sugar you want and all that. So basically, all these people are running around or trying to get around. They have malnutrition, and so their body just can't function. Their immune system can't function, and it breaks down. So it's kind of sad, really.
Wow. Hey, maybe I can read that book and we can do another episode.
Yeah, yeah.
I would love to because I that's such a topic now. I mean, not that it hasn't been for a long time, but it just seems more and more. It's just
Well, look, even in mainstream medicine, you start looking at their literature, they admit, and I think it's higher than what they say, but they'll say at least 50% of cancers are caused by nutrition and lifestyle factors.
Hmm.
I think it's higher than that, but let's say it's 50%. Well, I mean, that's a high percent. We know that the vast majority of cancers that people get do not have a strong genetic component to it. This is where people get confused because, there's all genetic testing when you have cancer, what drugs use and all that. And this is where people get confused. They're misled because now they think, well, my cancer is all genetic related. No, they're doing that testing because your cancer cells, as they're changing, because cancer cells change in their genes and all that. And so they're looking for susceptibility, how the drugs will work depending on what the genes are showing now. But that's different than people's predisposition to cancer and the genes they inherited. We know that, the vast majority of cancers, let's just say 85%, some studies say 90, do not have a strong genetic component to them. So what does that tell us? That tells us there's things we can do to be proactive with your diet, your exercise, your lifestyle, your body weight, avoiding environmental toxins, detoxification. So that's the good news. The good news is no, there's a lot of people they can do to be proactive for cancer prevention. But in
Yes.
our medical world, everything's after the fact. You get diagnosed with cancer and then you try and deal with it. And yes, nutrition and all these things we talk about in the book can help people, but obviously it's better to prevent than treat it.
Absolutely. Wow, that is such a good topic. I definitely want to do that. I'm gonna put a pin in it right now that
Okay.
I'm going to read that book and we're going to have another conversation because I think that it's needed. And I also think that, it takes a lot of courage to talk about these things these days. So I appreciate you doing that and, writing these books and having these conversations about it because people just don't know, people just don't know. Is there anything else well, I'm sure there's lots of things to say, but anything top of mind, anything you definitely want to include in this episode?
Yeah, I think you brought up a good point of the connection to the gut, not only to digestive problems, but whole body health. So when people realize that, they can help a lot more conditions by addressing the gut. And I've always, in my opinion, 31 years of practice, honestly, I've always seen the health food stores as a component of healthcare. Yes, I know it's not part of mainstream medicine, but remember, more people go to non-allopathic doctor for patient visits a year. More people going to naturopathic doctors and chiropractors, nutritionists. We look at total visits, we actually have more visits than you get in mainstream medicine. So in some ways, we're the standard, but I've always seen the health food stores as a component, of the healthcare system, at least in my world.
Thank you. That's what we're trying
Hmm.
to be is a good support system too. So we're all
Hmm.
in this together, in this holistic realm together. And now, where can people find you, Dr. Stengler, if they want to look up your practice?
Yeah, it's markstengler.com is my main website for a clinic here in Southern California.
Excellent. Awesome. And you work with people remotely?
Yeah, we do. We do telemedicine and all that too. Yeah.
Excellent. Oh, so good to know, especially since we're here on the East Coast. So, thank you again so much for being here. I hope everyone enjoys this episode and take some notes and learn something to apply to their life. And so, for everyone out there listening, just remember, stay healthy so you can stay happy. And we'll see you on the next one. Psst, can you do me a favor? Text the link to this episode to a friend who you know needs to hear this. By doing so, you are helping me with my mission to open minds to all the holistic health solutions that are available to us all. We hope you'll support our small business and shop ngvitamins.com for all your supplement needs. Oh, and don't forget to follow, hit the bell on your platform of choice so you never miss an episode. If you enjoyed this show, please consider sharing your review on iTunes. Until next time.